Hi, my name is Hayley Bublitz, and this is my presentation of parts number 5 and 6 for the Minority Group Project. We have been asked to choose and describe 2 behaviors in the culture of our chosen group and describe how these could impact healthcare delivery. The behaviors that I have chose to focus on are fluid gender expression and geographic isolation. This slide is going to focus on fluid gender expression. Among the Alaskan Natives is a group of people called the Aranutik. Fluid gender expression is a norm in their culture. This means that they conform to neither masculine or feminine categories. Typically, men, women, and children dress in a combination of masculine and feminine clothing. From an American cultural standpoint, this could be viewed as weird. Because some people in this culture choose not to conform to masculine or feminine categories, an American might perceive this as non-binary behavior. This would be a misunderstanding because non-binary is a term for people who don't fit in as either male or female, whereas the Ranutic identify themselves in regards to their soul, personality, and shade. In healthcare, this behavior might impact a patient-provider interaction in various situations. For example, if an Aranutic walked into a care facility dressed in favor of one gender, either more masculine or feminine, a provider could misidentify them. Providers would be likely to make assumptions about their gender and risk offending the patient by identifying them incorrectly. For example, they may say, "Hello, ma'am, sir," or etc. This slide is going to focus on geographic isolation. Alaskan Natives are often recognized by being geographically isolated. This is a behavior norm for their culture because it fosters their access to hunting, fishing, and farming. Many Alaskan Native communities are located in remote areas with great distance exists between them and urbanization. From an American cultural standpoint, this could be hard to understand. Because some people in this culture are geographically isolated, an American might think that they are uneducated because they don't have access to the same educational tools. However, Alaskan Natives do in fact manage to live an educated life, complete with unique programs that address their specific needs in rural and remote communities. In healthcare, this behavior might impact their health-seeking behavior. For example, if an Alaskan Native experiences a medical emergency in some remote area far from medical facilities, the distance, terrain, weather, and transportation options may affect their ability to reach necessary care. Instead, they may resort to community health aids, which could compromise the quality of the care they receive. So, how can a healthcare professional be culturally competent when providing health services to these groups of Alaskan Natives? To be culturally competent to the Urantic Alaskan Native group, healthcare providers should avoid making gender assumptions. If a healthcare provider makes sure that they address their patients neutrally, then they can avoid profiling and possibly offending the patient. The healthcare provider should ask the patient to identify themselves, and gender-related questionnaires should be read something like sex assigned at birth as opposed to man or woman. To be culturally competent to the geographically isolated Alaskan Native groups, healthcare providers should supply additional resources. If the healthcare provider could provide telehealth, mobile clinics, or an outreach program, medical care would be much more accessible. Providers should ask the Alaskan Natives, "What resources do you need?" or "How can I help?" This would provide patient-centered quality care.